Hello, I'm Dr. Don Eldridge of Valley Chiropractic, a Creating Wellness Center, and I wanted to go over with you a PowerPoint that we have done in our office regarding the ZERONA Fat Loss Laser. In the short PowerPoint, I'm just going to go over how the ZERONA works and how it can benefit you. For many of us, we struggle to shed those unwanted pockets of fat. We have dieted, exercised, and it can take months to show those results and just simply leaves us frustrated. And also with dieting and exercise, you can't necessarily select where the body is going to shed those inches. The other concern about body fat is in regards to our overall health. Clinical studies have shown body fat can lead to heart attacks, can increase our chances of strokes, high blood pressure, cancer, diabetes, osteoarthritis, and depression. But what if you had a motivator? A device that could shed inches in as little as 2 weeks, a motivator that could slim the body without pain or any downtime, and a motivator that could help you achieve those milestones faster, like getting into those skinny jeans again. Well, there is, and it's called the ZERONA Laser. Now, you may have seen in our office some of the advertisements about ZERONA, the information about it. You may have also seen it in various magazines or even on TV. It's been featured on the Dr. Oz show, Rachel Ray, the doctors, even on a lot of the morning shows. Well, I've got a short clip here for you regarding the ZERONA.
From the global resources of ABC News.
For the first time on national television, Drew is showing us the future of liposuction.
Now this is the ZERONA laser, and this achieves what we consider to be the holy grail of plastic surgery.
ZERONA. What it is a laser, a cool touch laser. It doesn't burn the skin. It's used on the outside of the skin to melt fat.
ZERONA, Z-E-R-O-N-A.
There's no pain, there's no downtime, there's nothing. Folks are losing around 4 inches off their bodies, but here they've seen some people losing around 11 inches.
It works.
This is see it, believe it results.
And look at this, is incredible. This is the kind of thing that you just dream about. I'm ready to do this.
I'm sorry.
No. I'm doing this. ZERONA, my ZERONA, here we come.
What's going on?
So where does ZERONA get its start? Well, years ago, when plastic surgeons were doing liposuction, what would come out typically from a liposuction procedure was a cottage cheese-like material. That was the fat cells coming out. The plastic surgeons were concerned about the pain that the patients were suffering, and so they began to use a handheld laser manufactured by a company called Zirconia. And they did this for the post-operative procedure, so to help reduce the pain. Well, they did notice when they started to use these lasers before the liposuction, that was the fat material that came out was liquefied. It was no longer in a cottage cheese. So something the laser did affected the cells, affected the fat material inside. That's where ZERONA got its beginnings. And since then, the ZERONA device was backed by a level 1 clinical study. It actually FDA market cleared for a non-invasive body contouring of the waist, hips, and thighs. So what are the basics of ZERONA? Well, it applies a gentle cold laser directly targeting the area of cosmetic concern. So if a pocket of body fat around the waist area, that would be an area that we would be able to target that laser specifically to reduce the fat in that area. As the laser slowly rotates over the treatment area, you will feel nothing. There's no heat, there's no tingling, there's no pain whatsoever. So this means ZERONA provides an effective treatment without any pain, risk of any side effect. So how does ZERONA work? Well, first, let's talk a little bit about the fat cell. As we age, we rarely accumulate any new fat cells. Instead, our fat cells have the ability to expand nearly 1,000-fold in size. That's like taking a toy car and expanding it to the actual size. Well, what's the ZERONA approach? Well, ZERONA's safe mechanism creates a small opening within the outer barrier, the outer wall of the specific fat cells. When the membrane is disrupted, the stored fat is released. This allows the body to use the released fat for energy production. So here is a MRI photography. As you can see in the left image, at 0 minutes, it's a clump of fat cells. Almost looks like a bunch of grapes. In 6 minutes in, you start to get a little bit of a breakdown of the cell membrane, and you'll see a little bit of the fat material has leaked out. At 12 minutes, you can hardly see the cells any longer because the fat has already leaked out. And then in 18 minutes, you see the shriveled up fat cell. Now, ZERONA lasers safely penetrate the skin, but only affect the enlarged fat cells. The laser does not go beyond the fat layer, again, targeting only the fat cells. So, how much fat does ZERONA release? Well, a typical 2-week, 6 sessions, the ZERONA will release about 2 liters of fat, which is about 12,600 calories. To burn this amount, you would have to swim for 40 straight hours, or play tennis for 21 straight hours, or jog for 17 hours. What does 12,600 calories look like? Well, that's about 42 cheeseburgers, 75 cartons of ice cream, or again, filling up a 2-liter bottle. So what happens to the fat? Well, the fat leaves the cell and enters what's called the extracellular space. The fat material is then absorbed by the lymphatic system. This is transported through the lymph vessels to the lymph nodes, where it's broken down by the macrophages, and then transported to the circulatory system. In the circulatory system, this is where they would be used as fuel. Again, this is a similar process to the body's natural use of fuel, the use of fat as fuel. The difference? Well, ZERONA can spot specific those areas that you want to lose the fat. Now we need to talk a little bit about the lymphatic system. The lymphatic system is like a flowing river that needs hydration and movement to be efficient for processing and removing fat from the body. Some examples of that would be working out, some cardio, massage, vibration, or even wearing compression like Spanx. So we need to stimulate the lymphatic system. The lymphatic system is surrounded by the muscle tissue. So when a muscle contracts, it actually squeezes on the lymphatic system, kind of milking or pushing the fluids so that they can, so in this case, the fat material can be gotten rid of. Again, the lymphatic system is like a flowing river, so it requires hydration. This is an important part. You want the lymphatic system flowing like a raging river. So if we say well hydrated, that will be great. When dehydrated, the lymphatic system is dry like a dry riverbed. Nothing moves. And also without proper force, like muscle contraction, the lymphatic system, again, would be a stagnant river, not moving very well at all. So hydration is key. Now, when we talk about hydration, we encourage water only. And you should drink at least half your body weight in ounces. So if you weigh 120 pounds, you should be consuming 60 fluid ounces of water, or about 4 bottles of water a day. If you weigh 200 pounds, 100 fluid ounces, or 6 bottles of water is consumed daily. Why no caffeine? Well, caffeine is a diuretic which dehydrates the body. Caffeine will then slow the process of moving the fat through the lymphatic system. However, if you consume caffeine, you need to replace it with 2 times that amount in water. Alcohol. It's important to understand your kidneys are like a dam regulating the retention and release of water. Alcohol blocks this hormone, resulting in your kidneys to release water, thereby creating more dehydration. So, who is a good candidate for ZERONA? Well, a person tired of having pockets of excess fat along their hips or waist or arms or thighs. Also, a person ready to successfully complete the ZERONA procedure, which we'll go over in just a little bit. So, in a ZERONA laser treatment, it will consist of a 40-minute total sessions. You'll do 20 minutes on the front side of the body and then 20 minutes on the back side. Again, we have talked about staying hydrated. So again, you want to drink at least half your body weight in ounces. Again, that helps the lymphatic system, helps remove the fat from the body. We also encourage you to do some light exercise, some jumping, bounding, wearing those compression shorts, massage, these things, again, to help stimulate the lymphatic system. And another important thing is to consider the diet. A healthy diet, staying away from processed, high carbs, that sort of thing. And we can go in more detail when you get on the ZERONA program. Now that we understand the protocol, how can we maximize those results? Again, we want to perform lymphatic stimulation at home. This can be through massage. It can be using a rolling stick. And again, we will demonstrate those during the procedure. Restricting alcohol, caffeine consumption. And again, making some basic lifestyle changes. Simply put, avoid a poor diet and get active. So what are some of those stimulations of the lymphatic system? Again, the vibration plate is a great way to stimulate movement of the body. 10 minutes a day is great with this. Wearing Spanx pants can also help stimulate the lymphatic system. Massage, either by a licensed masseuse or again by using a rolling stick in those areas of concern. Always massaging toward the lymph nodes. We'll show you that here in a second with the dry brushing. Dry brushing is another great way of stimulating the lymphatic system. Again, you're using the rolling stick or a dry brush. Works fantastic. Again, as you can see in the image here, you would want to roll the areas towards the areas of lymph nodes. Lymph nodes are found in the groin area, and they're also found up in the axilla or the armpit area. So you'll want to row downward from the navel down to the groin, legs rowing up to the groin. And if it's in the chest or the arms, you want to massage those areas towards the, again, axilla or the armpit area. Exercise is an important part as well. So 15-20 minutes of walking or mild exercise is great to stimulate that lymphatic system, again, helping to remove the body fat. So why ZERONA? Well, again, it's the only device backed by a level 1 clinical study. It's FDA market cleared for non-invasive body contouring of the waist, hips, and thighs. Clinically proven to be effective and safe. There is no downtime, no pain, and the results can be seen as little as 2 weeks. And it's backed by hundreds of thousands of patients who were just like you to become a true motivator to create a new, healthy you. So what else is out there when we think about fat loss? Well, one that's been around for quite some time is liposuction. Now, this is a surgery, so there's going to be pain. That can last weeks to months. Of course, swelling, bruising, soreness, numbness in around the area treated. Scar tissue would be forming with those where the incision sites were done. Baggy, rippling skin, permanent colors in the skin, possible damage to the nerves and skin. Now, another interesting thing about liposuction, if the patient gains weight after liposuction of hips, or thighs, and abdomen, then this proportionality will be deposited elsewhere in the body, creating what we call dysmorphia. And you'll see that on the bottom right side. So if you, say, have liposuction done in the abdominal area around the belly area, well, you've removed the fat cells. So if you were to gain weight, gain more fat, it can no longer go in those areas. But what would happen is it would go into other areas, like around the chest or the arms or into the hip area. Now, also with liposuction, again, you're looking at some prices of anywhere from $1,600 to about $3,400 per area. Another technique is called liposonic. Now, this uses high-intensity sonic waves to destroy the fat cells. Again, you're basically getting rid of the fat cells or destroying them. Now, with something like this, you're looking at inches lost at about 1 inch at about 3 months. You are going to have some side effects, redness, swelling, and possible bruising in those treatment areas. Average cost for liposonic, about $2,725. Another technique out there is called cool sculpting. Now, the FDA clearance for cool sculpting is the appearance of discrete fat loss. That's actually what is in the clinical trials that they did. Now, cool sculpting will freeze and kill the fat cells. So if anyone's been frostbite, you kind of know what that kind of pain feels like. And so you being a cool sculpting in what they do, freezing the skin, there is going to be some pain and even post-treatment pain that can last for anywhere from 7 to 10 days. temporary numbness, redness, swelling, bruising, tingling, stinging, and pain. And with cool sculpting, it's not an immediate result. You will see the results take months to see the results. The average cost is about $700 to $1,500 per area. And that's on the right, an image of a post cool sculpting. Now, an interesting question is, why would you want to kill the fat cell? Now, I think for all of us, we may think that, a liposuction or cool sculpting, getting rid of the fat cells completely would be a benefit. Well, we have to realize that fat cells do have a purpose. I mean, they're responsible for coagulation, immunity, appetite regulation, glucose, lipid metabolism. So they are important for a lot of different reasons. So the objective would not necessarily be to get rid of the fat cells, but just to make them smaller. Now, this is a clinical study that was done on 567 patients using ZERONA. In this study, the waist, hips, and thigh regions demonstrate an average reduction of 4.2 inches, and this was done in as little as 2 weeks. Now, the 7.7 total inches lost also included the arms, left and right arms, as well as the knee areas as well. But the 4.2 inches is what we typically look at, waist, hips, thighs, when we're measuring our patients. Now, these results, again, were done 3 times a week in 2 weeks. Now, the results do not include the results from our 1 time per week protocol, which showed even greater loss. So what does the 4 inches, or in the clinical trials, 3.52 inches lost look like? Well, 4 inches is the approximately equal to about 5 pounds or 2.7 liters of fat. So that's about filling up a 2-liter bottle of fat. That is what you would lose in the 2 weeks, 3 times a week protocol using ZERONA. Now, this was the actual clinical trial that got the FDA approval. It showed a 3.53 inch loss in 2 weeks without changing the diet or exercise. And it's, again, important to understand that with these clinical trials, especially a level 1 clinical trial, certain things have to happen. It has to be multiple sites. So this clinical trial was not just one location, one office. It was done at multiple offices across the nation. It was done on hundreds of patients. And you would also have a placebo group. You had one group that got the true ZERONA laser. The other group got a placebo or just red light. And what they found is that those who got the ZERONA laser did lose the 3.53 inches. The other group did not, simply put. The other thing, during the 2 weeks of clinical trials, those patients were not able to change their diet or increase their exercise or drink more water or anything. So the only thing that changed was the use of the laser to achieve those 3.53 inches. Now, in 2017, the ZERONA Z6 laser received a clearance from the FDA for body circumference reduction. Now we can treat anywhere in the body. So not only in the waist, hips, and thighs, but now we can actually target the arms or neck or back, knees, ankles, derriere, chest, anywhere in the body that you would like to reduce those unwanted fat. And here's a couple before and after pictures. The one on the left is the before, one on the right is the after. The other thing that we sometimes see with ZERONA is the tightening of the skin. We have seen that in several of our patients, and patients do ask about that. Again, the left is the before, right is after. This person was 6 treatments. Now, they did it twice a week for 3 weeks. You can see some of the toning there. Now, this one was 12 sessions. So this would have been 2, since we generally consider a package of 6 visits, this would have been 2 packages that this individual did. This one was 18 treatments, this individual. So 30.75 inches lost total. Now the patient results. Now I thought this was interesting here because what we're seeing is 93% of those who underwent Zerona were satisfied with the results. 7% were not. And I like this because in my theory, you can't make everybody happy. So we don't know what the 7% were not satisfied with. Perhaps they didn't lose as much as they wanted. But the fact that it didn't say 99 or 100% satisfied, I think that's kind of bogus. Again, I don't think you're ever going to make everybody happy. But to achieve a 93% satisfaction, that's pretty darn good. So what is the Zerona program? Again, we've mentioned this before, but again, the Zerona, each session will consist of 40 minutes under the Zerona light. It's 20 minutes on the front side, 20 minutes on the back. Now we have the ability with the Zerona, since there are 6 different lasers on the Zerona, we can target multiple areas. So we're just not targeting just belly fat around the abdominal areas. We can target the abdominal and the hips or the thigh area as well. We can target up in the chest area as well if wanting. But it is a 20 minutes on one side. We'll flip you over 20 minutes on the back side. Now, we also encourage you to drink lots of water to reduce consumption of alcohol, caffeine, or if you're going to consume alcohol or caffeine, just increase your intake of water. We're also going to encourage you to do some light exercise, wearing possible compression garments, using the rolling stick, massage to keep the lymphatic system flowing. We're also going to encourage you to change the diet. If you are eating fast food or eating a lot of processed foods, we can talk to you about how to change the diet to improve the benefits there. Again, we've talked about there's no pain or downtime during a treatment. You're laying there, while laying there, you can relax, you can take a nap, or you can update your Facebook status on your phone. Again, a typical treatment package will include 6 visits. And that can be done 3 times a week, twice a week, or even once a week. Whatever's convenient for your schedule, we can make that work. So, again, the details of a session, you'll get 6 treatments. We'll give you a rolling stick to be used at home to massage, as we had talked about, rolling always to the lymph node area. So if you're rolling the abdominal area, you're going to roll down towards the groin area. If it's the thighs, you're going to roll up to the groin. We also give you a 1-month supply of Curba. This is a vitamin that contains some niacin, contains some artichoke, and this is good for fat metabolism. Now, we also do in our office what's called a foot detox. That's the image on the far right. We put a copper array in the water, and it actually positively and negatively charges the water. And what this does is help detox out the bottom, the pores of your feet, which are the largest pores in the body. This is a great way of detoxing. So this also helps, we think, with the metabolism of the fat. So are you ready? If you are, let's get started. Victory is only a few weeks away. So how do you get started? Well, you need to call our office at 502-937-4000, and we can set up a consultation. We can discuss the pricing and get you scheduled right away. You can also visit our website at valleychiropractic.com, and we have a page on Zerona there with some other videos and more information. I hope you've enjoyed the PowerPoint. We are glad to present it to you, and we hope to hear from you soon. Have a great day.